Namaskar. Good afternoon, everyone. My name is Jaba Roy. As a regular viewer, now you know that we have started our Facebook Live session post COVID every alternate Tuesday. You can keep your Facebook notification on so that whenever we are having a live session, you get the intimation. Whoever is seeing our live session today can write to us and we will try to address all your issues. Otherwise, also you can reach out to us and we will answer it through email or through call. All our consultants are also available on video consultations. So sitting at the comfort of your home, you can discuss your health issues with our consultants. As also here, I would like to mention that all of you know that from yesterday, countrywide vaccination has started. It's better that you register through an app called CoWIN. Otherwise, if there is any problem in the software, you can reach out to your preferred hospital. It's first come, first serve. Those who are having 60 plus years with in blood thinner, it's better that you take a certificate from your consultant. Those who are having an age between 45 plus to 59 with comorbidities also required a certificate from your consultant. So now let me just introduce our consultant urologist, Dr. Jayant A.S. Dr. Jayant A.S. is a consultant urologist with Sagar Hospital, Bangalore. He has completed his MBBS, MS in general surgery, DNB, MRCS from Edinburgh, UK, MCH, genitourinary surgery, and a member of prestigious MNAMS. Before joining us, he worked with Bombay Hospital, Manipal Hospital, and in super specialty hospital in UAE for 8 long years. And after that, he came back from UAE and joined us. Good afternoon, Dr. Jayant.
Very good afternoon, Jaba. Thanks for the nice introduction.
Yeah.
Namaste to everyone.
Yeah. So, let's start with the question.
First let me tell, it's almost 1 year back, the COVID started, the lockdown, everybody was at home. Now the things are getting better, and today I saw downstairs more than 1,000 people are getting vaccinated in our hospital, and now the number of cases also has come down drastically. The things are getting better. Now we should start our regular work, and this is a very good hospital for especially urology setup, and we have a separate ward for the COVID patients to treat, so we don't mix up the normal patients and the COVID patients.
True. We have the green zone and the red zone.
Red zone. So there is no problem. Now people can come to our hospital. They can
get treated best treatment from our doctors.
This one.
Yeah. So I would like to start with prostate, and later I will go to the kidney section.
Okay.
Very novice question that what would be the weight of the prostate, and when it enlarged, how people will come to know that the prostate has got enlarged and is it time to go to a neurologist?
Yes, there is a well say in English that a person will struggle to make money until 45 years. Then after 45 years, the person will struggle to make urine. That is there's a proverb in English, okay. So the prostate is a gland which is just below the urinary bladder, and because of the hormonal variations in the body, it gets enlarged for all the males. Okay.
Generally, is it?
For everybody it gets enlarged. But in few people it may be symptomatic, in few people it may not be symptomatic.
What is the weight generally, when it is a normal?
Yeah, usually it is about 20 grams.
Okay.
Anything about 20 grams, it is an enlargement of the
Okay.
prostate. It
So
can even
how-
go up to 150 grams
Oh
also.
my God. Okay.
Okay.
So what would be the symptoms when the prostate gets enlarged?
Yeah, after the age of 40, 45, when this prostate start getting enlarged, the patients start having the symptoms of prostate, what we call it as lower urinary tract symptoms, LUTS. The patient will pass urine again and again frequently.
Okay.
He will get urgency to pass urine immediately. Even after passing urine, he will not get satisfied.
Okay.
He feels something is left behind.
Okay,
The
okay.
flow of urine will not be continuous, it will
Okay.
be intermittent.
Okay.
He has to put pressure to pass urine.
Okay, okay.
There will be recurrent urinary infections. These are all the, and he will take lot of time to pass urine
Okay,
in the
okay.
bathroom.
Okay.
These are the symptoms of prostate,
Enlargement.
enlargement of the
Okay,
prostate.
okay. What is generally the cause of this enlargement?
Yeah, it is basically the hormonal variations in the body.
Okay, okay.
After the age of 45, because of the hormonal variations,
Okay.
the prostate start getting enlarged.
Okay, okay, okay. So, does this need any kind of investigation prior? The person feels that the prostate got enlarged as
Yeah.
a precautionary measure.
Yes, once after the age of, especially after 45 years, when the person starts developing these symptoms, he should come to the hospital and consult a urologist.
Okay.
We assess the symptoms. There is a scoring system also for these symptoms. We
Okay.
will give points by points,
Okay.
and we will grade that patient a mild symptoms, moderate, and severe symptoms. According to that, we will investigate the patient.
What are the various investigations?
Well, yeah, for initially basic investigations like ultrasound we have
Okay.
to do for the prostate,
Okay.
and the uroflowmetry. How is the,
Okay.
there will be a machine and a patient has to pass urine over that.
Okay,
There
okay.
will be a sensor. It will record the flow of urine.
Okay, okay.
And one PSA, prostatic specific antigen test we will do,
Okay.
which will rule out any cancer in the prostate.
Okay, okay.
And in the ultrasound also, we will come to know how big is the prostate, how much urine is leaving behind post-void residue, and urine test, regular urine test we will do. Seeing all these things, we will come to know, we will grade the prostate in grade 1, grade 2, grade 3, grade 4, like that.
So, if a person, does his health check
Oh.
regular basis, like generally we advise them being into the hospital that once in a year.
Yeah.
So, can that be detected that he is going towards the prostate
Yes,
enlargement?
definitely the person who is going regular health check, ultrasound or uroflow or PSA test, they can definitely come to know their prostate is enlarged.
Enlarging, huh.
And before the symptoms get worsened, we can start
Can we
the
restrict
treatment.
it? Can we restrict it?
Yeah, we can reduce the size of the prostate also to some extent with some
Okay,
medicines.
okay.
There are medicines for
So, does all prostate enlargement requires a surgery?
No, this was true about 20 years before.
Okay.
Now, in the last 20 years, the things are getting better. There are a lot of good medications have come.
Okay.
What we used to operate 20 years before, now almost 80 to 70 to 80% of the prostate surgeries have come down.
Okay.
Because of the invention of these alpha blockers like alfuzosin, tamsulosin, silodosin. These are a group of drugs, alpha blockers, which will help the patient to pass urine. And there are one more drugs which like finasteride, dutasteride, which will reduce the size of the
Size,
prostate. So almost 80% of the patients we can treat with the medicines, but at some point of the will come where these medicines will not act. Then we should plan for surgery.
So once you do the surgery, it will come to the normalcy, or he has to, after the surgery also he has to go on a medication for lifelong?
No, there is no medications after the surgery. We will make a good channel for the urinary passage.
Okay.
And there are various types of surgeries also for this. With now The recent one is the laser surgeries, what we are doing. There are types of lasers like holmium laser, thulium laser, KTP
It's a
laser.
painless one?
Yeah, it's definitely painless. There will not be bleeding, and on the day of the surgery, only patient can go home.
On a
Uh,
daycare basis?
on a daycare
Oh, okay.
basis,
Okay.
and with excellent results,
Okay.
and he need not to be on these medications.
Okay.
Okay, and yes.
What is a prostate cancer and what is PSA per se?
Yeah, prostate for every patient when he comes to a urologist after, especially after the age of 45, we take an opportunity to do a prostatic specific antigen. It is a tumor marker of any prostate cancer. Usually up to 4, it is the normal.
Okay.
4 to 10 of PSA is the gray zone, and above 10 is a probably it is a cancer patient.
Okay.
Then we will subject the patient to further investigations like biopsy of the prostate, trus ultrasound, CT, MRI. After that,
Okay.
first initially with just PSA only, we can diagnose that there is a chances of or probability of prostate cancer, and we can take the next
Okay.
treatment.
How serious this prostate cancer is?
Yeah,
Is
basically.
curable, not curable?
Yes, that's a good question. Yeah, prostate cancer is a disease where if you are cursed with a cancer, you must ask the God that give me prostate cancer.
Oh my God.
Oh, it's a very, very slow growing indolent cancer.
Okay.
But of course, there's a age factor also. Like the people almost after 80 years, 85 years, almost every patient will have a prostate cancer.
Oh, okay, okay.
Not necessarily all of them to be treated.
Okay.
But there are some people like at the age of 45, 50, 60, when they develop the prostate cancer, then we have to really go behind that prostate cancer, give the proper treatment for the prostate cancer.
So I have gotten a question that will BPH become a prostate cancer?
No, the chances are very less.
Okay.
Basically, prostate cancer is more of a hereditary in nature.
Okay.
Any family history of prostate
Okay,
cancer,
okay.
it should be thoroughly investigated, especially father, brothers, when they have the prostate cancer. These people regularly undergo this PSA testing,
Okay.
and very 1 year once.
Okay.
And if there is a elevation of the PSA, we will do a trus ultrasound and a biopsy of the prostate and see if there is a prostate cancer. Then we will go ahead with there are 3 types of treatment for prostate cancer. One is for surgery. We will take out the entire gland. The other one is the radiotherapy, where we will give the radiation.
Okay.
The one more modality of treatment is hormonal treatment for the prostate cancer.
Okay, this become an education for me. I never knew that prostate cancer is hereditary.
Yes, it is hereditary.
Okay.
Sometimes a lot of prostate cancer can be hereditary.
Okay, okay.
There are some genes who carrying those genes, they will be it can run in the families.
So our next question is, Doctor, what precaution has to be taken by young adults to take care of their prostates and kidneys to avoid further damage in future?
Yes, prostate. Yeah, when there is a prostate enlargement, there will be urinary symptoms, obstructive symptoms like difficulty in passing urine.
She has mentioned that young adults. How, what is the ratio generally you get that the young adults is having a prostate enlargement?
Usually prostate enlargement only occurs after the age of 45.
Oh, okay.
Before it will never occur.
Okay.
There is, you cannot stop that also because of the hormonal changes in the
Right.
body. But once the symptoms started, once the symptoms of the prostates you start getting, then if we treat with the medicines, the symptoms get better. Further damage to the bladder or to the kidneys, we can avoid those things.
So, does this help in lifestyle modification, or it has nothing to do with lifestyle modification?
No, the prostate enlargement
Has
there is
nothing to
has
do
nothing to do with lifestyle modification,
Okay.
and we cannot stop its enlargement.
Okay.
But once it gets enlarged, we can maybe in the later date we can reduce the size by giving some finasteride to those medicines. But it can never become normal again.
Okay. What are the symptoms, if someone having a prostate cancer? Is it painful, or,
No.
in general, if the person having, a urine problem or something,
Yeah.
and he knows that the prostate has been enlarged, but whether it is a cancerous one, is there any other symptom to
No,
know?
there is no other symptom for prostate cancer.
Other than coming
It
to
is
the
the
urologist.
same what prostate gets enlarged. It is the same symptoms occurs in prostate cancer also.
Okay.
Only we will do the PSA, prostatic specific antigen.
Okay,
We will diagnose the prostate cancer and we will go further.
Okay.
There is no further treatment. Symptoms.
That's it.
Maybe when it gets the prostate cancer spreads to the whole body,
Yeah,
there will
that's
be a
the
lot of
different
that is a
one.
terminal,
Yeah.
and there will be a lot of other symptoms
True.
like body pain, bone pain. Those
true.
are
That goes to the next level.
next level. And initially there are no symptoms.
So, if anyone has a prostate cancer, will he first see an urologist or an oncologist?
Usually, when a prostate cancer patient, they will end up with urologist only.
Okay.
They will come to a prostate examination, and
Okay.
we do the PSA testing. And
Okay,
when we
okay.
examine, we feel that prostate hard nodule or something, and we this one, and we are going to
Refer
proceed,
it, to the
this one.
oncologist?
No, usually prostate
only
cancer
treat that.
treated by urologist.
Okay. Okay. So, the radiation, etc., if
Ah,
required.
if the radiation is required, we will refer it to radio oncologist.
Okay. Lot of education. So, now I'll come to the kidney.
Yeah.
As 11th March is World Kidney Day, as per WHO.
Yeah.
So, let me ask you a few of the kidney related questions.
Yes.
What are some common kidney problems?
Basically, kidney is the one organ where it is on the either side of the loin or on the either abdomen, just from behind. Okay, and it is like a filter. Okay, whatever toxic bodies we produce inside the body, it will filter it out. It will take out from the body.
Okay.
Okay, that is the function of a kidney.
Okay.
And there are many kidney problems, especially nowadays. And from surgical point of view, there are a lot of kidney failures because of sugar, those things, nephrotic. I am not talking about that. That will come under a nephrology group.
Yes.
Surgical problems of the kidney, like most common problem of the kidney is the stone problem in the kidney. Lot of stones, especially 5 to 10 people out of 100 people will have a stone in their kidney.
How the stone form?
Yeah. Coming to the other diseases, like there can be infections in the kidney, cancers in the kidney. Yeah, as you said, stone is the main problem of the kidney. So we will concentrate only on the stone problems, which can be operated and which we can give 100% cure to the patient also.
Okay.
Yeah, how the stones are formed? This is a common question. Most of the people will have this stone problem and its symptoms. Usually it happens because not drinking enough water. What we call dehydration.
Okay.
When a person doesn't drink enough water to wash out all the salts in the kidney, the salts in the kidney will stay back there and form a stone. This is what we call supersaturation theory. When the salts in the kidney stays there only, it will not go out, it will form a stone. Most commonly it is a calcium, calcium oxalate stone.
Okay, it becomes solidified.
Solidified. Because if you don't drink enough water, or if you are a manual,
It's not able to flush out.
out this one, and it will form a stone in the kidney. It can be calcium.
So,
calcium.
what is a good amount of intake of water?
Yes, it is usually depends upon your weight also, but usually 2.5 to 3 liters of water. Other than what we take, even our food also will have water. I am not talking. Usually 2.5 to 3 liters of water one person must drink.
You know, when we talk of the water, you know, I can ask you as, you know, like a very layman question, that generally we take, all of us take an RO water. And RO water is nothing but dead water. They flush out all the minerals, you know, out, and they throw out everything, good, bad, whatever it is. So, is that okay to take that mineral water 2.5 to 3 liters? What do you say?
No, there is no studies regarding what type of water it is. Whether it is mineral water or hard water or smooth water. Nothing will, there is no study that, oh, this water will cause stone, this water will not, nothing like that. Taking less water will definitely cause stone. Taking more water will reduce the stone. There is nothing like mineral water or having this one
Good
will
water,
not
bad
good
water.
smooth water, hard water. There are some people hard, drinking hard water can cause stone. There is nothing like that. And not only, this is the one water, this one. There is now, because of the lifestyle changes, people eat lot of meat, red meat, especially beef and all, even chicken, mutton, whatever it is. If it is beyond certain limits, that will cause a uric acid stones in the kidneys. And especially these pizza, cola, chocolates,
the fast food.
The fast food, this can also cause stones.
Okay. I have a you know, prostate related question here. What is the probability of death by prostate cancer?
It depends upon, when we do the biopsy, we will come to know what is the grade of the prostate cancer. In that we will do grading like Gleason scoring system. Less than 7, 7 and above 7, 7, 8, 9 like that. It depends upon the grade of the prostate cancer. Lower grade cancers like 3 plus 3, 3 plus 2, the chances of death by the prostate cancer is very, very less. Of course, there are high grade cancers, especially in young people with high grade cancer, the chances of mortality is more.
Okay. And one more question, that do all kidney stones need surgery or medicine work for removal of kidney stones? Yes,
this is a very classical question. Yes, when every patient comes, should I get operated or not, like that. We will see where is first we will investigate the patient with a X-ray, ultrasound, urine test. We will see where is the stone, how big is the stone, if it is in the kidney, ureter, bladder, and how big is the stone, less than 5 millimeter, more than 5 millimeter. Usually less than 5 millimeter don't need any treatment, and more than 5 millimeter stones, they warrant some treatment. And again, where is the stone? If it is in the kidney, the treatment is different. If it is in the ureter, the treatment is different. If it is in the bladder, the urinary bladder, the treatment is different. Depends upon the size, depends upon the location of the stone.
What is the normal investigation you recommend?
Normally for the stone problem, we do a X-ray and ultrasound and urine test, basic blood test about the kidney. Now the gold standard to see where exactly the stone, how big and all, it is the CT scan. It is a CT scan plain is the gold standard. This one.
So MRI and all this is
not no MRI is required for the kidney. CT scan is enough.
Okay, so the treatment generally you do is all in daycare basis, or do they need to admit in the hospital?
Yeah, now most of the treatments we are using lasers and all for the treatment of the kidney stones or the urinary bladder stones, ureteric stones, and the scopes what we are using. Before we used to cut open, and patient has to be at least for a 15 days to 1 month in the hospital and all. Now we are doing it through the natural passage only. We will pass a small catheter, all very small, minute instruments. We will go inside to the bladder, ureter, and even to the kidney, and we will use the lasers to break the stones, and we will remove it. And it is all done. Most of the almost 90% of the stone surgeries are being done now as a daycare. This one patient has to get admitted in the morning, get it removed. By evening they can go home, and next day they can go to office also. No need. That is the advantage of the new modalities of treatment: lasers, no cut, nothing.
Okay. So once these
Even laparoscopy will have a small cut, but the what we do for in urology for stones, it does not have a cut also. It will just through directly endoscopy and removing this.
Okay. So for this, any GA is required?
Yes, anesthesia is required. Depending upon the location of the stone. If it is in the kidney, ureter, or bladder, anesthesia is required. Nowadays, even the anesthesia, if they give also within 2-3 hours, they will recover and they can start taking food and they can go.
Okay. So once this, the stones removed once. Is there any possibility that they can be reformed or come back?
Yes, definitely there is 70% of chances of a patient having again stone in their life.
But then why?
That's why we tell them to drink more water. Then they have to change their lifestyle. They have to drink more water. They have to be away from the junk foods like cola, Pepsi, pizza, all the junk foods. They have to avoid chocolates.
Even chocolates?
Chocolates is the oxalate. That is the one which causes stones everywhere. Whether it is a kidney stone or gallbladder stone.
I think is a take back. The chocolate is the most dangerous.
Chocolate, to make it palatable, they will add oxalates into it. That is why chocolate name is oxalate. It contains oxalate. When it goes to either liver and gallbladder, it will form a gallbladder stone. If it goes to kidney, it will form a urinary. Oxalates will never get washed out. So all the kids now, they eat so much chocolate and their whole life is getting ruined because of this lifestyle. Once in a while, even I too have chocolate once a week or once a month, having 1 or 2. It should be fine. Not every day having 5, 10 every day. Definitely their kidney functions will deteriorate.
Okay. So one more question that somebody has said that is a very good information. And what is the role of robotic surgery in urology?
Robotic surgery, especially the prostate cancers. Now, being prostate is a very deep situated organ below the bladder. The accessibility to the prostate is very difficult with a naked hand and with this one. Now the robotic surgeries, we can go deep into the pelvis. We can remove the prostate. That is really changed the surgery options for especially prostate cancer.
And it's 100% that you can remove through the robotic thing?
If it is a localized disease only in the prostate, we can remove entirely with the robotic surgery.
Okay. All right. So, how to prevent stones that you have already mentioned, but then
drink more.
Is a take back from Dr. Jain.
You must drink more and more water, at least 3 liters of water. Change your lifestyle, reduce non-vegetarian, especially in red meat, beef and all, eating less. Okay. Then don't put added salt to the food. Whatever salt is there, that's fair enough. If
Okay.
you go on adding more salt to the food,
Mhm.
make it more palatable, this one.
Okay.
Junks like pizza, cola, Pepsi, chocolates,
Mhm.
and it should be avoided.
Okay, okay. All right, so is this already a time? What is, okay, we have addressed all the questions and we have already the time is, thank you so much. Thanks for all the questions you have shared, and if there is any more, you can write at infobsk@sagarhospitals.in and Dr. Jayant will address all these. And as I mentioned earlier, you can also do a video consultation if you are so scared to come to the hospital, but we have the green zone mostly and we are extremely safe. And as mentioned, the vaccination has started from yesterday, so please get vaccinated and make India safe. Thank you so much. Thanks for all your time.
Thank you. Thank you very much.